Hello, friends. Hope you're doing well. Welcome to my YouTube channel. Please subscribe if you haven't done yet. And I also request you to hit the bell icon so that you can get the latest updates. I welcome you all in today's session. And today's session is all about US healthcare insurance. In our previous session, we discussed about an overview on US healthcare delivery system. In today's session, we are going to understand what is health insurance, how it works in US, United States. And like I was saying, that in our previous session, we have discussed about introduction to US healthcare delivery system, components of US healthcare, the external factors affecting the evolution of US healthcare, and the key major players of US healthcare like members, payers, providers, and payments. So we had discussed this, and if you want to go over that video, you can go to my go to our YouTube channel, and this is the URL. So you can search by US Healthcare Business Analyst vlogs, and then you'll be able to see all the previously recorded videos there. Now, in today's session, we are going to focus on US health insurance. Health insurance. So let's talk about it. Let's start with what is health insurance. So as we know, insurance is a way of guarding against the financial risks that are always present in life. It is a product for which we pay a small, certain amount in order to protect ourselves from having to pay a much larger amount in the event of an economic loss. Health insurance is a type of insurance coverage that covers the cost of an insured individual's medical and surgical expenses. Insurers use the term provider to describe a clinic, hospital, doctor, laboratory, healthcare practitioner, or pharmacy that treats an individual. The insured is the owner of the health insurance policy or the person with the health insurance coverage. So this is what is about health insurance. Now let's move on. How many types of health insurances are there in United States? So we have private health insurance. There are a couple of government sponsored health plans present there, and there are based on how they're providing the health insurance. There are some other types which we say indemnity health insurance and managed care plans. Let's talk about this one by one. So what are private health insurance? The Centers for Disease Control and Prevention says that the US healthcare system relies heavily on private health insurance. Private health insurance refers to any health insurance coverage that is offered by a private entity instead of a state or federal government. Insurance brokers and companies both fall into this category. And we have many options, the way we can enroll in a private plan or insurance, including we can take help from insurance brokers, licensed agents, health insurance offered through an employer, such as a group health plan, federal or state marketplace plans. And there are some examples of private health insurances like Blue Cross Blue Shield, Humana, Anthem, Aetna, Cigna, United Healthcare. What are the public sponsored or government sponsored or federal sponsored health plans? So public health insurance is funded and supported by federal or state government. In the United States, the two most common public health insurance plans are Medicare and Medicaid. It's important to note that we may have to pay for public health insurance, and the way they pay is, for example, people with Medicare pay a premium for Part B. And we are going to talk about what is Medicare, what is Medicaid, what is this Part B. We will discuss in our upcoming sessions. Let's see how many different types of public sponsored health plans we have present there. So we have Medicare, Medicaid, the State Children's Health Insurance Program, we say CHIP, the Department of Defense, DoD TRICARE, TRICARE for Life programs, the Veterans Health Administration, VHA program, and IHS program, Indian Health Service. Now let's discuss about other types. Indemnity health insurance. So I was mentioning earlier as well, there are like other types, indemnity health insurance and managed care plans. They also define an insurer by the way they are administering their plans and connect with the healthcare providers, and that's what how it makes them different. So that's why we are saying other types, and they're known as indemnity health insurance and managed care plans. We are going to talk about indemnity health insurance. An organization represented, and this is very important. This is very important to understand. An organization representing a group of people, usually an employer representing employees, contracts with a health insurance company to buy insurance protection for the members of the group. The employer or the other group that purchase the group insurance contract is known as the policy holder. And in our previous session, we talked about policy makers. So policy holder and policy makers both are different. Employees or others who are covered by the group insurance contract are known as the insured group members. The group policy holder usually pays the premiums for the group health insurance coverage to the insurer as those premiums become due. Premiums are the periodic payment amounts necessary to keep healthcare coverage in force. However, the group policy holder may collect some or all of the money for these premiums from the insured group members. When an insured group member needs medical attention, he or she visits a doctor or hospital of his or her choice and receives treatment. After receiving medical treatment, the group member submits a claim, a request for payment under the terms of the group insurance policy to the insurer, and the insurer then pays the benefit, the amount of money that compensates for the loss incurred, to either the insured or the healthcare provider. This system, in which the insurer will either reimburse the group member or pay the provider directly for each covered medical expenses after the expense has been incurred, is known as fee-for-service payment system. This benefit payment system is distinguishing characteristics of traditional indemnity health insurance plans. Now let's talk about managed care plans. In this type of plan, the insurer will have contracts with a network of healthcare providers to give lower cost medical care to their policy holders. There will be penalties and additional cost added to the out-of-network hospitals and clinics, but they will provide some treatment. Now, since I mentioned about they contract the network of healthcare providers, in one of the video which I made, we talked about US healthcare providers, we talked about in-network providers, out-of-network providers. I request you to go through that video. It's present in my channel and you can refer that. I'll be giving the link of that video in the description. You can check the description as well. Now, what are the type of managed care plans present there in the United States? They are Health Maintenance Organization, HMO, Preferred Provider Organizations, PPO, Point of Service, POS, Exclusive Provider Organizations, APO, Consumer Driven Health Plans, CDHP that we say. Underneath of that, we have Health Savings Account, HSAs, HRAs, and FSAs, Health Reimbursement Accounts, and Flexible Spending Accounts. Let's talk about it in detail. And like I said, we are going to focus on all these different managed care plans in more detail in our upcoming sessions. Let's focus on the next agenda that we have, and we are going to learn the cost of private health insurance. Like, how do they decide the cost of private health insurance? Health insurance companies decide the premium based on several factors. It includes the age. The older we are, the more likely we need healthcare. To account for this, insurance companies charge higher premiums to older plan members. Then, whether you use tobacco, smoking and using tobacco increases the risk of developing your health issues. Another factor is your location. Where you live has an impact on your health. It also impacts how much competition there is among insurance companies and how expensive it is to provide healthcare. The next factor is the number of people on your plan. An individual plan is less expensive than a family plan. Your dependent, like your spouse, your children. Health insurance companies can't charge higher premiums based on gender or on specific health history. They can charge a higher rate if you have diabetes. For example, many people get private health insurance through an employer. Employers typically pay for the part of the cost of health insurance, and employees pay for the rest. Employees paid an average of, let's say, $1,427, and this is based on one of the survey. So that's where I have given this figure. Let's say the employees paid an average of $1,427 annually for individual coverage in 2018, according to one of the survey. Then they paid an average of $5,431 for a family plan. You see the difference here? This comes to $118 per month for an individual plan and $452 per month for a family plan. Huge difference. So private health insurance purchased on your own, not through an employer, is significantly more expensive. The average cost of an individual plan purchased on your own is $440 per month. The average cost of a family plan is $1,168. This comes to $5,280 per year for an individual and around $40,060 per year for a family. The cost of health insurance is also dependent on other components. Now, let's talk about how health insurance protects you from the health insurance and financial risks. No one plans to, as we know, no one plans to get sick or hurt, but most people need medical care at some point. Health insurance covers this cost and offers many of the important benefits. Health insurance covers essential health benefits critical to maintaining your health and treating illness and accidents, like ambulatory patient services, outpatient care you get without being admitted to a hospital, emergency services, hospitalization like surgery and overnight stays, pregnancy, maternity, and newborn care, both before and after birth, mental health and substance use disorder services, including behavioral health treatment. This includes counseling and psychotherapy, prescription drugs, rehabilitative and habilitative services and devices to help people with injuries, disabilities, or chronic conditions gain or recover mental and physical skills, laboratory services, preventive and wellness services, and chronic disease management, pediatric services, including oral and vision care, but adult, dental, and vision coverage aren't essential health benefits. Health insurance protects you from unexpected high medical costs. You pay less for covered in-network healthcare even before you meet your deductible. Now, what is copay, deductible, co-insurance? We are going to talk about in our upcoming session. You get free preventive care like vaccines, screenings, and some checkups even before you meet your deductible. That's how it protects you from health and financial risk. Now, so that's all about a high-level overview on health insurance. And like I was saying in our previous session, we talked about healthcare delivery system, introduction to US healthcare delivery system, components of US healthcare, factors affecting the evaluation of US healthcare, and the key major players of US healthcare. Today, we talked about what is health insurance. Then we had a high-level discussion on private health insurance and government-sponsored health plans. We are going to talk about managed care plans and these government-sponsored health plans in more detail, like what is Medicare, what is Medicaid, and how it works. And then in our next session, we are going to talk about components of health insurance policy and the things we need to consider while choosing the best healthcare plan. So I request you to go through the previous sessions and this session, because in this way you'll be able to connect and understand the fundamentals of US healthcare domain. If you'll go through these videos one by one, you'll be able to connect each dots, and that's how you can learn the fundamentals of US healthcare. Then, like I was saying, there were some videos which I have already prepared, which you can access from here. This is my channel, so I'll take you to my channel. This is US Healthcare Business Analyst blogs. You can subscribe to my channel. You can hit bell icon to get the latest notification. These are the sessions that I have done. So this you can see the session that I did on US healthcare industry overview. And today we talked about US health insurance. I'll be providing the link of all these existing sessions that we have finished in the description of today's session. I request you to go through these videos. Feel free to put your comments in the comment section, and I'll personally reply to that. I would definitely appreciate if you can give your feedback and suggestion. Thank you very much for your patience and listening to this session. Thank you for your time again. I really appreciate that. Stay safe.